sickle cell disease. It affects millions of people throughout the world, and yet most of us know little, if anything, about it. Many believe it is a predominantly African American condition, when in fact it affects people of African, Hispanic, South Asian, and Mediterranean descent.
Sickle cell disease was formally recognized in 1910 by Dr. Herrick, in which he recognized the sickle shape of a blood cell.
Sickle cell disease is a genetic condition with no universal cure. It gets its name from the shape of the gene that defines it. All told, about 2 million people are living with the disease, 100,000 of them in the United States. Here in the Mid-South, approximately 2,000 people have been diagnosed with sickle cell, while many more carry the trait, which is asymptomatic. As a result, there's no way of knowing if you're a carrier unless you're tested. Today, newborn screening is compulsory, but if you're 25 years old or older, there's a good chance you were never screened.
The process of getting screened for sickle cell disease and trait is very simple. It can be as simple as a drop of blood from a finger stick all the way just to a tube of blood to check to see if you have this problem or this condition.
The probability of a child inheriting either the trait or disease hinges on the combined sickle cell status of the parents. The range is a wide one, from no chance if the parents are trait and disease free to a 100% chance if both parents have the disease.
Sickle cell disease is a lifelong painful syndrome. If you are unaware of your sickle cell status, fall into one of the ethnic groups that are at risk of being a carrier, please go get tested.
The first signs of sickle cell disease usually manifest themselves well before a baby's first birthday.
At about the age of 4 to 6 months, during what we call the fetal hemoglobin or the baby hemoglobin switching over to adult hemoglobin, this child will begin to possibly have their first symptom of sickle cell disease.
But what exactly is sickle cell disease, and how does it affect the body?
Sickle cell disease is a genetic condition due to a single mistake in the gene that codes for hemoglobin. This results in the cells becoming sticky, stiff, and having difficulty flowing through blood vessels. A normal, healthy blood cell looks like this. It's round, it has a pocket to carry oxygen normally. A sickle cell looks more like this. It does not have the ability to carry oxygen and has difficulty flowing through bloodstream.
So, what does this mean to someone living with the disease?
People with sickle cell disease are at risk of a whole host of problems, including blindness, organ damage, organ failure, skin ulceration, and an inability to fight infection.
The disease can also trigger swelling of the hands and feet, blood clots, anemia, joint pain, and what is known as a sickle cell crisis.
The pain is sometimes excruciating. It feels like a tightening, a squeezing. I can have pain anywhere because this is a disease that affects the red blood cells, which are over my entire body. So sometimes it's in my chest, it's in my back, it's in my legs, it's in my arms.
So how do we treat this pain? One, we use strong IV pain medication and IV fluids. Then we look behind the pain to see if there's a trigger, like a change in weather, some type of infection that creates this inflammatory reaction in these individuals. We also look for any kind of drop in their blood counts that could be painful in itself. And there's a whole host of other things we look for behind the scenes. There's a lot of misinformation about sickle cell disease. One of those myths is that you can catch it like an infectious disease.
They just want to touch me. Even some teachers would ask my mother, is it contagious?
Another myth is that these individuals are drug addicts because of their pain and the need for pain medication. And therefore, they have a difficulty navigating through the healthcare system.
They also have to deal with unfounded and hurtful rumors sparked by long hospitalizations and absences.
When I was out for almost three months, When I got back to school, it was a lot of rumors going around saying that I didn't want to be there, or I couldn't handle what people were saying about me, or I got pregnant.
Such rumors and misconceptions can make transitioning into the workplace that much harder.
Throughout my work history, I've still had to deal with the leg ulcer, which caused me, great physical problems. So jobs were limited because I was not able to stand, not able to walk long distances.
There's some people that just don't understand what it is to live life differently. Some people don't want to be patient. Some people don't want to go with you to the emergency room. Some people don't like it when you miss out on scheduled plans. But eventually the negative people find a way to exit out of your life. So I only focus on the positive people now.
When we get consumers together, it's about, yes, you have the disease, but we're not going to have a pity party. Yes, you were told that you were going to die at 18, but now you're 30. Okay, so let's get a reality check and let's see what we can do to live our lives out to the fullest. The mantra for the Sickle Cell Foundation of Tennessee is improving the quality of life. And we provide several different social services to our clients.
When I started being involved in the Sickle Cell Foundation of Tennessee, which is going on about 3 years now, I found a way to be energized. I found a way to be active. I found a way to live life again, in a sense.
The Sickle Cell Foundation of Tennessee was a godsend for me. They had the resources, they have the education necessary, and they have the compassion.
It's been a good experience for me too. And I go basically in support of her, but found out that there are a lot of things that interest me also.
The Sickle Cell Foundation of Tennessee is improving the quality of life of sickle cell families all across the Mid-South. Won't you join us in our efforts? Get tested, get going, get involved. You too can make a difference.